Hi, my name is Dr. Ruth Rimmer, and I'm going to talk to you a little bit today about life care planning.
My name is Kevin Foster. I'm Director of Burn Services at the Diane and Bruce Alley, Arizona Burn Center, Valleywise Health in Phoenix, Arizona.
My name is Dr. Sood. I'm a plastic surgeon who practices burn care currently in Augusta, Georgia.
Since becoming a life care planner in 2004, I have had the opportunity to not only prepare life care plans, but also to teach life care planning.
I have been at the Arizona Burn Center since 1999, so I have 26 years here as the burn director.
I've been doing burn care for about 32 years, having trained in general surgery for 5 years, plastic surgery for 2 years, and hand and microsurgery for another year.
For the past 20 plus years, I have been preparing life care plans for catastrophically injured individuals with an emphasis on burn, electrical, amputation, and trauma injuries.
My interest in burns stemmed from the fact that it is a wonderful combination of general surgery and plastic surgery for me, and the team approach for burn care, which is has to be done as a team concept, is very important.
Taking care of burn patients is unique. First of all, the acute care is really unusual in the medical field because it takes a long time. So somebody with a 70 or 80% total body surface area burn is probably going to spend 3 or 4 or 5 months in the hospital just with acute care alone.
When I look at burn care across the spectrum, the thing I tell my patients and families is that it is a forever injury. A burn patient not only suffers injury to their skin, they suffer injury potentially to their lungs if they've had an inhalation injury, to their psyche. It is a total body injury.
Issues with sleep, issues with pain, issues with anxiety in children, itch issues, all of the problems that go along with burn injury.
Following acute care, patients require intensive outpatient care. We have to reconstruct contractures, disfigurements, areas that are dysfunctional, and oftentimes this takes multiple procedures over a many-year period of time.
While a burn injury is horrific physical injury, it is also very damaging psychologically. A person one moment looks like they've looked for the last however many years their age is, then they go through this terrible injury to their skin, which results in scarring and hypo and hyperpigmentation, and they don't look like they did before. It's very difficult for people to accept the changes, and so they need help with that.
Life care plan is critical for these burn patients. It essentially provides a framework for life care, and life care planning and developing a life care plan takes all of that into account and puts it in a format that's easily understandable and usable for the patient.
When doing a life care plan on a burn patient, it's extraordinarily important to have a burn expert involved with the preparation of this plan. Burn injury is a total body injury. It affects every major organ system, every tissue, in addition to affecting the psychological and psychiatric status of the patient. So it is really important to have somebody that can address all of these areas in a life care plan.
It's very important when preparing a life care plan for a burn patient that there has to be an emphasis on the psychosocial ramifications of the burn, re-entering the community, learning to adapt to the changes in function and physicality that burn patients need to do. That needs to be included in a life care plan because it's a very important part of the recovery journey. Truly, with a serious burn, their life has been changed forever.